My name is my name is Self Inspector, and today uh, we are going to learn about peritonitis. Peritonitis is a serious disease condition that starts in the abdomen. That is the area of the body between the chest and pelvis. Peritonitis happens when the thin layer of tissue inside the abdomen becomes inflamed. The tissue layer is called peritoneum. Peritonitis usually happens due to infection from bacteria or fungi. There are two types of peritonitis. These are spontaneous bacterial peritonitis. This infection is caused by bacteria. It can happen when someone has a disease such as liver cirrhosis or kidney disease. And the second is secondary peritonitis. Peritonitis can happen due to a hole, also called rupture, inside an organ in the abdomen, or it can be caused by other health conditions. It is also important to get treatment first for peritonitis. And healthcare providers have ways to clear out infection. They also can treat any medical problem that might cause peritonitis. Treatment usually involves medicine that usually for infection caused by bacteria called antibiotics. Some people with peritonitis need surgery. If you don't get treatment, peritonitis can lead to serious infection that spread through the body. It can be deadly. Yeah. A common cause of peritonitis is treatment for kidney failure, called peritoneal dialysis. This treatment helps to get rid of waste products from the blood when the kidney struggles to do job themselves. If you get peritoneal dialysis, you can help prevent peritonitis with food hygiene before, during, and after dialysis. For example, if it is important to wash your hands and clean the skin around your garden. Symptoms, signs, and symptoms for peritonitis include um, belly, if you have belly pain or tenderness, bloating or feeling fullness in abdomen, fever, upset stomach and vomiting, loss of appetite, diarrhea, reduced urine, thirst, unable to pass food or gas, feeling tired, confusion. If you get peritoneal dialysis, peritonitis symptoms also include cloudy dialysis fluid, white flakes, strands or clumps which are called fibrin, and dialysis fluid. And when should you see the doctor? Peritonitis can be life-threatening if you don't get treatment quickly. So call your healthcare provider right away if you have severe pain or tenderness in your abdomen, bloating or feeling fullness along with fever, upset stomach or vomiting, reduced urine, thirst, and not able to pass stools or gas. And if you get peritoneal dialysis, call your healthcare provider right away. If your dialysis fluid is cloudy or has unusual color, has white flakes in it, has strands or clumps in it, smell unusual, especially if the area around your catheter changes color or is painful. Peritonitis also might happen after a past appendix or serious injury to your abdomen. Get medical right away if you have severe belly pain. It may feel so bad that you cannot sit still or find comfortable position. Get emergency medical care if you have severe pain, belly pain after accident or injury. Yes. What are the causes of peritoneal infection? Peritonitis. What are the causes? Peritoneal infection is usually caused by a hole in an organ in an abdomen, such as stomach and colon. The hole is usually called a rupture. It's rare for peritonitis to happen for other causes. Common causes of hole that leads to peritonitis include medical procedures. Peritoneal dialysis uses tubes called catheters to remove waste products from blood. An infection may happen during peritoneal dialysis due to unclean treatment room, poor hygiene, or tainted equipment. Peritonitis also may happen after digestive surgery. Using feeding tubes can also lead to peritonitis. Peritonitis can happen after procedures to take out fluid from your abdomen, such as for conditions such as ascites in liver disease. In rare cases, it can be a complication of an exam to check inside of rectum or colon called colonoscopy. Peritonitis can happen after procedures to check digestive tract called endoscopy. This is also a rare case. The other cause is a rupture appendix, stomach ulcer, or a hole in colon. Any of these conditions can allow bacteria to get into peritoneum through a hole or your digestive tract. Pancreatitis, this is um, inflammation of gland in an abdomen called pancreas. If you have pancreatitis and you get an infection, bacteria could spread outside the pancreas. This may lead to peritonitis. Diverticulitis, infection of small bulging patches in digestive tract may cause peritonitis. This could happen if one of pouches break open. The pouch could spill waste from intestine into abdomen. Trauma injury may cause peritonitis. This could allow bacteria or chemicals from other parts of the body to get into peritoneum. Peritonitis can happen without a hole or there is called spontaneous bacterial peritonitis. It is usually a complication of liver disease such as cirrhosis. Advanced cirrhosis causes a lot of fluid buildup in your abdomen. That fluid buildup could lead to bacterial infection. What are the risk factors? One of the risk factors is peritoneal dialysis. Peritonitis can happen in people who get treatment. Other medical conditions, certain conditions raise you risk to peritonitis, such as liver cirrhosis, appendicitis, stomach ulcers, radiculitis, Crohn's disease, and pancreatitis. In history of peritonitis. If you have ever once had peritonitis, you are at risk of getting it again and maybe higher than someone who has never get. What can be complication? Without treatment of peritonitis, it may cause whole body infection called sepsis, which is very dangerous. It can cause shock, organ failure, or death. How can we prevent? Peritonitis that is linked with peritoneal dialysis is often caused by germs around the catheter. If you if you use peritoneal dialysis, take these steps to prevent peritonitis. Wash your hands before touching the catheter. Scrubs under your fingers and between your fingers. Clean the skin around the catheter with antiseptic every day. Store your supplies in clean place. Wear surgical masks during dialysis fluid exchange. Talk to your dialysis care team about correct care of your peritoneum dialysis catheter. Your healthcare provider may prescribe antibiotics to prevent peritonitis, especially if you had peritonitis before. Antibiotics also might be prescribed if you have buildup of peritoneum fluid due to medical conditions such as liver cirrhosis. If you take medical cold proton pump inhibitors, you might be asked to stop it. Thank you for listening and watching my channel. Thank you. Until next time, let's learn together. Thank you.